suicide a health crisis? So let's start with some of the facts. In 2017, 47,000 people in the United States died by suicide. This number is underreported and has only increased in the last 2 years. Today, approximately 1 person in the United States dies by suicide every 10 minutes. So think about that. That's 6 people an hour. It's 144 people every day, 7 days a week. 1 person dies by suicide in the United States every 10 minutes. By the end of this talk, another 6 to 10 people will have died by suicide. The Center for Disease Control says that 5 to 6% of the population have thoughts of suicide. Women attempt suicide at 3 times the rate of men, and yet men die by suicide at 4 times the rate of women. And the secret behind that is men choose guns and other weapons that it's hard to survive. Women primarily choose pills or some other method. More people die by suicide than homicide in the United States. And more than half of all suicides in the United States are men aged 35 to 65. Over 90% of people who die by suicide are suffering from a major psychiatric illness or a substance abuse disorder, or both. Only 20% are receiving mental health care. Depression is a factor in 50% of suicide, and untreated depression is the leading cause of suicidal behavior. So, here's a myth: no one can stop a suicide. It is inevitable. The fact is, if people in a crisis get the help they need, they will probably never be suicidal again. Another myth: confronting a person about suicide will only make them angry and increase the risk of suicide. The fact is, asking someone directly about suicidal intent lowers anxiety, opens up communication, and lowers the risk of an impulsive act. Only experts can prevent suicide. Fact is, suicide prevention is everybody's business, and anyone can help prevent the tragedy of suicide. Some additional facts and myths. Suicidal people keep their plans to themselves. Most suicidal people communicate their intent at some time during the week preceding their attempt. And in the trainings, they refer to these communications as invitations. And so think of it as someone who's really struggling, suffering, in a lot of pain, and they want the pain to go away. And so they give you subtle clues. One of the challenges in the teachings is to be better attuned to those clues so that you can recognize them and then reach out to the person. A connection to someone who's suffering with thoughts of suicide will in fact save their life. Any connection, human connection, will make a difference. Those who talk about suicide don't do it. The fact is, people who talk about suicide may try or even complete an act of self-destruction. Once a person decides to complete a suicide, there's nothing anyone can do to stop them. Again, that's a myth. The fact is, suicide is the most preventable kind of death, and almost any positive action may save a life. So what are some contributing factors to suicide? Failed relationships, imperiled careers, legal trouble or injury, mounting debt, unmanageable depression, anxiety, substance abuse. They're all pretty common. Many people who are suicidal have more than one, but all it takes is one. Now, in my course of discovery about suicidal ideation, I attended a Kennedy Forum meeting in Chicago that was, the major presenter was Michael Schoenbaum, the Senior Advisor for Mental Health Services in Epidemiology and Economics at the National Institute of Mental Health. And one of the things that really was impressing me about Michael Schoenbaum was he's a wonk. I mean, he studies statistics, and yet he was able to boil his presentation down into 3 simple things. One was, there's no single solution, but a lot of little solutions. But doing nothing is not an option. And that's really critical. Many of us miss, dismiss, or avoid the signs of suicide. And what Michael impressed upon us that day was that the tools are available. And so the people who study suicidal ideation and people who die by suicide know what we have to do in order to connect to them, to save their life. But we need to do a better job at finding and helping the people who are suffering with these thoughts of suicide. Another key finding was that suicide is a hidden risk, and they show up at the emergency room for some other health problem. But one of the things they've learned over time is that if you ask someone directly about suicide, they will tell you. And that's really a critical finding. 10 years ago, virtually no hospital emergency room asked about suicidal intention. Today, most emergency rooms screen for suicide risk. And so if you go to an emergency room for anything, on intake, someone will ask you if you've ever had thoughts of suicide. The other interesting thing for me is, I went to see my doctor about 3 years ago. And during the wellness check, which used to be called a physical until the insurance companies got involved, my doctor asked me if I had had thoughts of suicide. And I was really kind of struck by that. But that goes right back to the discoveries that these people at the National Institute of Health had discovered, that if you ask someone directly, they will tell you. But you have to ask directly. And so that's a fundamental principle in any of the gatekeeper trainings that we've been going through here at Thrive and in the community, is helping people learn how to ask directly about suicide. It seems like a very simple thing. Are you having thoughts of suicide? But it's really, really hard to do. And yet it's essential. Getting over your own taboos about suicide and being willing to ask someone directly, are you having thoughts? The most effective intervention is not hospitalization. We don't want to keep people alive until Tuesday. We want to keep them alive. And so those were some really extraordinary insights that I learned from Mr. Schoenbaum. There's another expert that I'll introduce you to. Oh, another finding they found was that follow-up phone calls or postcards, a simple human action that connects you to someone who had a suicidal attempt, will reduce subsequent suicidal attempts by 30 to 40%. And so what happens is, if a person goes to the emergency room because they had a suicidal attempt, and in the following week after discharge, if they get a postcard from someone in the hospital or a phone call, they're 30 to 40% less likely to attempt suicide again. Simple act of connection between human beings will reduce suicidal ideation. So this is Dr. Richard McKeon, and he was the keynote speaker at a 2018 summit on prevention of suicide. And Richard is different than Michael Schoenbaum. Richard's a policy wonk, Michael's a data guy. And so Richard is really curious about things that we can do to reduce the number of deaths by suicide. One of the key things he said is that it's increasing, which the numbers bear that out, and it's more than a mental health concern. It's truly a crisis in our communities. He also said that we all have a role to play in reducing the incidence of suicide. And so he expanded it to be beyond the mental health professionals to all of us. But this is really the key thing that I took from it. In order to have any impact, we need to get better at helping people understand what their role is and providing them the tools to help those at risk. Fundamental, simple, and yet it's pretty hard to do. So, a little bit about the effort in the community. Thrive is part of the Mental Health Awareness Suicide Prevention Task Force, and these are all of the partners in the community who meet with us at least quarterly. The Oak Park Police Department, the Village of Oak Park, the Township of Oak Park, River Forest Township, River Forest School District 90, Oak Park High School, River Forest High School, NAMI, River Edge Hospital, Hines VA Hospital. We have representatives from the faith-based community, and we have several local therapists. And so we all get together, quarterly at least, and we talk about what we can do to affect change in our community that's a positive change that will result in fewer people dying by suicide. So some of the things that we have learned, and this comes from something called the 10 Pillars of a Suicide Safer Community, is we have to raise awareness. And so one of the things that Thrive is doing to raise awareness is we got our staff trained in Safe Talk, which is a suicide awareness 3.5-hour workshop. NAMI, with that support of the Community Mental Health Board of Oak Park, introduced Support for You, which is a text-to-tip service at the high school. And so our youth at the high school can text to a phone number if they're struggling, or if they identify a friend who might be struggling, and it's anonymous. But it's based on an algorithm of language, and so if the text, as it evolves, they're texting back and forth with a professional on the other end of the line. If it gets above a certain alarm level and they think the risk is too high, then they interrupt the text with a phone call, and they connect the person to someone who can help. Could be Thrive. Thrive has been called a couple of times in the last year by the people who monitor the text-to-tip support line. It's in both middle schools in Oak Park, it's in the middle school in River Forest, it's at the high school, and I think this year it's also at both Fenwick and Trinity. And so it's something intended for youth. I don't see many adults texting the support line, but it was put in place to get the youth more comfortable if they felt that there was someone who was struggling and needed help. The other thing that we've also been trained in at Thrive, we have several people trained in QPR, which is question, persuade, and refer. And we did that at the request of the high school. So the first piece is to raise awareness. The second piece is prevention. And much of the prevention is also Safe Talk and QPR. Now, in the last, 18 months, going back to July, so maybe it's 15 months of last year, Thrive has had therapists and staff trained in ASSIST, which is Applied Suicide Intervention Skills, but also trained to be trainers of Safe Talk. And so in the last 15 months, Thrive has conducted over 14 Safe Talk workshops and trained over 290 people in the community in a suicide awareness training, Safe Talk. We did 3 at the high school last year, and the challenge with the high school is these trainings are 3.5 hours, and it's hard to get 3.5 hours of student time. So after last year, we sat down with some of the staff and came up with a different protocol that we came up together to decide on what was something that we could do in an hour to an hour and a half, and that's QPR. QPR is question, persuade, refer. And so for the last 2 weeks, Kristen Kelleher, who just came and joined us. Kristen, you want to stand up and be recognized? Okay. Kristen and I are both trained to be trainers of QPR. And so we started training the freshmen at the high school in QPR. It's done over a 2-day period, 45 minutes of a video and a lecture, and then the second day is another video, a review, and then role play. By Wednesday of next week, we will have introduced QPR to 400 freshmen and 90 upperclassmen. And so half of the freshman class will have been exposed to suicide awareness training. We'll do the other half of the freshman class in January, February. So I'm really grateful for that partnership that we now have with the high school, and it's allowing us to raise awareness with the youth in this community. Those are the prevention pieces. Intervention, we chose last year to train 13 of us in ASSIST, which is Applied Suicide Intervention Skills. It's offered by a company called Living Works International. It's also enhanced our ability with our crisis team. We have a team of crisis workers who are partnered with the local police and fire departments who provide mental health interventions and crisis interventions. And so now they're also trained to provide suicide interventions. And what's critical about that is, as we raise awareness and we train more people to be helpers in the prevention of suicide, if they encounter someone who's struggling with thoughts of suicide, they can refer them to us at Thrive because we're trained to be interventionists. The next step is post-intervention, and that's if someone actually has a suicidal attempt and it's not successful. They need to get into counseling very quickly. And the last piece is post-vention, which that's why Kathleen is here for loss. At Thrive, we do grief counseling, but we don't specialize in counseling for suicide loss, for people who have lost someone to suicide. That's what loss is here for. A Suicide Safer Community is something that was introduced to me by the people at Living Works, and there are 10 pillars that you have to be able to accomplish in order to get that designation. And so one of the 10 pillars is to have a steering committee. And so we've done that with the consortium that I shared with you. And so that's one of the things that we can take some pride in. We also know that 5 to 6% of the community, and so if we're a community of 60 to 65,000 people, are having thoughts of suicide. And so that's more than 4,000 people in our community are having thoughts of suicide. Now that doesn't mean they're all going to act on those thoughts. In fact, most people who have thoughts of suicide don't act on them. But the notion that there are 4,000 people in our community having thoughts of suicide is one of the reasons why we're doing this. So that if we can encounter people who recognize them, we can get them help before they act. Again, we lose 6 to 7 people on average in our community every year. And this year, based on the results from the last 4 to 6 weeks, we're going to be above the average. That's not a good thing. I owe a lot to Living Works Education and to the QPR Institute. I personally have been trained to be a trainer of both Safe Talk and QPR. And it's really enlightened me and changed my perspective. I also will tell you a little bit of a personal story. In 2015, I personally went to 3 funeral services for people who died by suicide. And that sort of started me on this path because I looked at the audience and I just sort of blank stares. People were like a deer in the headlights. They just couldn't comprehend why someone would choose to take their own life. And so that had such an impact on me that as I got more involved with Thrive and eventually became the executive director, I became part of that suicide awareness, mental health awareness, suicide prevention task force, and we began to take action, to train our therapists, to enhance our crisis team's abilities to work with the police and the fire departments, and to actually begin the hard work of educating the community. And so I'm really grateful for the opportunity to do that. There's a sheet up on the front desk where the sign-in was on the 10 pillars. It's pretty informative. Yes, that's it right there. And we're trying to model that the Mental Health Awareness Suicide Prevention Task Force has adopted that, those 10 pillars as a guidepost for us so that we can do a more effective job at educating the community and training people and actually trying to reduce the number of deaths by suicide in our community. Jack?
Hey, John. If you had, what resources does Thrive need to take this to the next level?
Well, that's a really great question, Jack. Thrive, as someone asked me earlier, Thrive used to be Family Service of Oak Park and River Forest, and Thrive is a non-for-profit. The current state of affairs in the state of Illinois, and in fact even in the country with respect to mental health issues, is they're underfunded. And so any of the services that Thrive provides to the community are underfunded. These talks are not sponsored by anyone. And so Thrive is doing these talks as a service to the community. One of the things I try to explain to people is that anything that you want to contribute can help. And so if you feel moved in any way, go to our website, you can make a donation. We're very appreciative of any funds that come our way because honestly, everything we do loses money. And so we're dependent upon the community in order to introduce new services and new programs like this. We don't get very much money from the federal government anymore, and we get less and less money from the state, and we even get less and less money from the Village of Oak Park. And so most of the way we cover our losses is through the largesse of the local public who are basically beneficiaries of Thrive. To get to the next level, Jack, we're doing what we can, following the 10 pillars. I don't think it's so much a question of what, if we had, say, $100,000 more dollars, what would we do differently? I think we're doing the things we need to do, and they're underfunded. And so we did get a nice grant from an anonymous source for $50,000 recently, just to support the Suicide Safer Initiative. And so that's helping the work we're doing at the high school. That's helping us pay to have 10 clinicians do no clinical work for the next 2 days and sit in class to be trained to be applied suicide intervention skills. And so those are the things that we're willing to invest in to make sure that we're giving back to the community. Does that answer your question? Okay. Yes?
If you have someone who has clearly expressed suicidal intention,
Okay.
what is the number one recommendation that your programs would?
Okay, the number one thing is to engage with them, okay? To make sure that you're confident that and if they have expressed to you that they're having thoughts of suicide, okay, then don't leave them alone. The number one thing is do not leave them alone, okay? Now, as someone who's trained in assist, the first thing you do is you try to assess, are they just having thoughts or have they made a plan? And so that's kind of where you go first. Did you make a plan? And if they respond yes, then talk to me about your plan. How involved is it? How far along are you in your thinking? And the next question is, have you acquired the means? Okay, do you have a gun? Do you have a rope? Do you have a knife? Have you stockpiled pills? And so that's what an interventionist is going to walk down that path. But someone who's not a therapist, who's not a clinician, who's not trained, what we want them to do is identify someone who's having thoughts of suicide. And if they think that person is at risk of acting on those thoughts, call an interventionist. Okay, call Thrive, call our crisis team. They're trained in interventions. Call us, and we will then go and help. Okay, and if we can't sufficiently diffuse the situation, then we'll make sure the person gets taken to an emergency room. Okay, question in the back?
Hi, my name is Pete. I just wanted to thank you, John, for being there and Thrive for supporting this. I do more and more of these presentations, the better, because it fights that other terrible last word, stigma. Not only is it a society bad word, even in individual families, they don't want to talk about mental illness. They don't want the neighbors to know. They don't want the other family members to know. And the less people know about suicide, mental illness, the more possibility that somebody is can unfortunately pass by suicide or something else. And stigma is one of the biggest things we need to fight to prevent things like this or prevent other ways people get sicker, I guess, or anything else happening in the future. So more events like this, more presentations for the community, make it a stronger community where we're all helping each other out, and people aren't ignorant to the fact of they're just people with mental illness and addiction and other things are people who are just struggling and, like you said, really want help. Sometimes they just don't know how to ask for it. Sometimes they don't know what they actually need. So thank you for being here.
Well, thank you. One thing I can tell you is our experience with these trainings with the police and the fire department, they're really grateful that we're putting these trainings on. And what they've expressed to me is that they actually lose more officers to suicide than they do in the line of duty. And so they wanted the trainings for them and for their team as much as they wanted it for the community. But it's hard. I mean, honestly, it's really, really hard. The other surprise for me as we did the trainings with the firefighters and the police was almost a cathartic moment for many of them, because part of the training is during the role play, they have to ask the question, are you having thoughts of suicide? And then they have to switch roles. A common experience was relief when they actually asked the question or when they were asked the question. Because if someone's truly suffering with thoughts of suicide, they're often given off these subtle clues because they're worried about stigma. They're worried about being a burden to others. And when someone asks them directly, and again, this is the evidence that all these gatekeeper trainings is based on, they'll tell you directly. But you have to be asked directly. And so that's what we're trying to do with this education at the high school and throughout the community, is to get people more comfortable asking the question. Because it's really essential. Have a human connection, ask the question, get over your own fears, and potentially save a life. So, I mean, it seems simple, but it's still really hard. I've been doing these trainings at the high school now for a week, and a common experience from the freshmen is, boy, is that awkward. Boy, that was hard. I didn't like asking the question. Whereas with the police and firefighters, it was relief. For the youth, it's still, the training is, I'm uncomfortable. Why are you making me do this? And so we have to try and get people out of their comfort level, because you can truly save a life if you ask someone directly. So, final thought, talk saves lives. And so it's that simple. If you see someone who's suffering with thoughts of suicide, make a connection and connect them to help. Okay? Thank you. We have local resources as well. There's a sheet out front at the front desk. Thank you, Lynn. I also wanted to let you know that last week, actually it was last month, the village of Oak Park made a proclamation during National Suicide Prevention Month, and they recognized both the Mental Health Awareness and Suicide Prevention Task Force, Thrive, the Community Mental Health Board of Oak Park, River Edge Hospital, national organizations like NAMI, and international groups like Hope for the Day, and the effort that we're doing to openly discuss suicide and mental illness in our communities and bring forward a coordinated and thoughtful manner. So this was done in September at Village Hall, and it was be it further resolved that mental health matters to individuals, companies, organizations, and we challenge every resident to learn more about mental illness and see a person for who they are, take action, raise awareness, and make a difference. And this was done on the 16th day of September in 2019. Thank you. Okay. If we don't have any more questions, there's some snacks, there's coffee. Yes,
We're plugging for other talks.
yes, there's a sheet up front. Steve Parker will be presenting at the next Ride Talk, which is November 14th, and he will be discussing, thanks. So hot topics to enrich your life, becoming an even better parent. And so if you plan to see Steve, please be advised, last year, Steve spoke during the polar vortex, and we had a packed house of 135 people. And so if you plan to come early to get a seat, because Steve is a very popular speaker. And it's a better topic. Yes?
Would this topic apply to parents of young adult children who are still living at home, or is it really focused more on like elementary? Yeah.
I think, yes, everything. Steve talks about all of that,
Okay.
okay?
And a couple others.
Well, yes, we also have Marion Cisetti with us, and Marion's going to speak in connection with Sarah's Inn about the challenges for people who are battered. Right?
Domestic violence.
I'm sorry?
Domestic violence and its impact on the community.
Okay. And
When is that?
Heidi's going to talk on anxiety in youth.
Yes,
And-
and an expert from Northwestern is speaking on, I think it's elder care.
Elder care. So those are the 5 topics for Thrive Talks for this. There will be one in November, that's the Steve Parker one. And then the next 3 will be in the new year. I think one in January, one in February, we might take March off and do one in April, I'm not sure. But it's on our website. So please go to the website and please come back for the other Thrive Talks. Thank you.
Thank you, John.